Hi everyone, I am Sheila Punayo. Today I'm going to demonstrate on how administering oxygenation through cannula and mask. Oxygenation methods by which oxygen is supplemented by higher percentage than what is available in atmospheric air. The purposes are to relieve dyspnea, to reduce or prevent hypoxemia or hypoxia, to elevate associated with struggle breath. The equipments required are clients, chart or Candex, oxygen connecting tube, flow meter, humidifier filled with sterile water, and oxygen source wall outlet or oxygen cylinder, tray with nasal cannula or appropriate size or oxygen mask, and kidney tray, adhesive tape, scissors, oxygen stand, and the no smoking sideboard, and gloves if available. Check doctor's prescription including date, time, flow, liter, minute, and methods to avoid medical error. Perform hand hygiene and wear gloves if available to prevent spread of infection. Good morning, I'm Sheila Punayo. I'm your caregiver today. May I know your name please?
Leo.
And when your birthday?
23.
Is that okay to check your wristband? The procedure that we are going today is the administering oxygen through cannula and mask, so you can breathe properly. Lightning, matches, or smoke is dangerous. Make sure that you don't have all the things. Is that okay to you?
Yes.
Assemble equipments. Organizations facilitates accurate skill performance. Prepare the oxygen equipments. Attach the flow meter into the wall outlet or oxygen cylinder. Fill humidifier about 1/3 with sterile water or boiled water. Humidification prevents drying of the nasal mucosa. Blow out dust from the oxygen cylinder to prevent entering dust from exits of cylinder to the nostril. Attach the cannula with the connecting tubing, the adapter on the humidifier. Test flow by setting flow meter at 2 to 3 liters per minute and check the flow on the hand. Testing flow before use is needed to provide prescribed oxygen to the client. Adjust the flow meter settings to the ordered flow rate. The flow rate by the cannula should not exceed 6 liters per minute. Higher rates may cause excess drying of nasal mucosa. Insert the nasal cannula into the client nostrils. Adjust the tubing behind the client's ears and slide the plastic adapter under the client's chin until he or she is comfortable. Proper position allows unobstructed oxygen flow and ease the client's respiration. Maintain sufficient slacks in oxygen tubing to prevent the tubing from getting out of place accidentally. Encourage the clients to breathe through the nose rather than the mouth and expire from the mouth. Breathing to the nose inhales more oxygen into the trachea, which is less likely to be inhaled through the mouth. Initiate oxygen flow to maintain doctor's prescription and avoid oxygen toxicity. Assess the patient's response to oxygen and comfort level. Anxiety increases the demand for oxygen. For administering through oxygen mask, prepare the oxygen equipment. Attach the humidifier to the treated outlet of the flow meter or regulator to maintain the proper setting. Connect the tubing from the simple mask to the nipple outlet to the humidifier. Set the oxygen at the prescribed flow rate. The oxygen must be flowing before you apply the mask to the client. To apply the mask, guide the elastic strap over the top of the client's head. Bring the strap down to just below the client's ears. This position may hold the mask most firmly. Gently but firmly pull the strap extension to the center the masks on the client's face with a tight seal. The seal prevents leaks as much as possible. Make sure that the client is comfortable. Comfort helps relieve apprehensive and lowers oxygen need. Remove and properly dispose of gloves. Wash your hands. Respiratory secretions are considered contaminated. Place no smoking signboard at entry into the room. The sign warns the client and visitors that smoking is prohibited because oxygen is combustible. Documents the following: date, time, method, flow rate, respiratory condition, and response to oxygen. Documentation provides coordination of care. Sometimes oxygen inhalation can bring oxygen intoxication. Sign the chart to maintain professional accountability.